Hey everyone, welcome back to the Neuro Health broadcast. Today we are talking all things functional medicine with Dr. Madison Vidovich of Great Lakes Health, Ohio. This is a great episode if you were ever wondering what functional medicine is, how it can help, who it can help, and maybe how that differs from conventional medicine. Dr. Madison was great at making all of this information digestible and actionable so that after you listen to this, you should have a very good understanding of what to expect and what to look for when seeking a provider who practices functional medicine. So, after a quick announcement from our sponsor, we'll get right into it with functional medicine and Dr. Madison Vidovich. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Everyone, welcome back to the show. I'm your host, Dr. Joe, and today we are joined by Dr. Madison Vidovich of Great Lakes Health and Wellness. Thank you for
Hi,
joining us.
guys. Thank you so much for having me. I really appreciate it.
Of course. I'm really excited to get you on today because you're going to be the first one who's going to dive in depth into functional medicine. And it
Yay.
is such a cool aspect of healthcare that really needs your expertise today.
Absolutely.
Dr. Madison, before we get too deeply into that topic, though, can you give our listeners a little bit of a background on yourself and why you got so interested in functional medicine in the first place?
Sure. So my name is Dr. Madison, Dr. Vidovich. I go by both. I currently hold a doctorate in naturopathic medicine as well as chiropractic medicine from National University of Health Sciences in Chicago. So I went down the rabbit hole of functional medicine / naturopathic medicine when I was in college. I was just really not doing all that great with my health. I was experiencing 20 plus migraines a month. And I was one of those people that was carrying around a pill container or pill bottle everywhere I went. I felt like an old lady in my 20s. So I sought out to find a different option. So through my research, what I found was naturopathic medicine, which is very similar to functional medicine in a sense. And I completely shifted my major in college and wanted to do something more similar to the natural route.
Mhm.
So, functional medicine, a lot of people hear the word, they're familiar with hearing that term on social media. It is kind of a buzzword right now. But what functional medicine is, it is a patient-centered approach to healthcare. So, what that means is I spend a couple hours assessing everything about you. So, your lifestyle, your habits, your social habits, your sleep, your eating, every little thing about you. And I put together a very specific treatment plan to fit your life and to basically remove the root cause of your disease and or dysfunction.
That is phenomenal. And I
Yeah,
think that's what a lot of people listening are seeking. So that's perfect.
absolutely. Absolutely.
So you mentioned first that you had gotten your doctorate in naturopathic medicine,
Hmm.
but you would consider yourself a functional medicine practitioner.
Yes.
Can you, just for the listeners who may be unaware of the difference or what
Mhm.
either one is, can you kind of
Yep.
break down the difference and how one path may have led to the other?
Yes. So naturopathic medicine, this is a very much root cause approach medicine. This is my passion. The one thing I will say is we are not licensed in every state to practice medicine, even though we do go through the 4-year program, the board exams, the residencies. We are not recognized in all 50 states. So the difference between naturopathic medicine and functional medicine is there are plenty of certifications out there to qualify you as a functional medicine specialist. You can be a nurse practitioner, a chiropractor. It all depends on what certification you do go through. Now, a lot of the functional medicine training is very much into the naturopathic training. So it is very similar. It's just what degrees do you hold, what certifications you hold, and comes down to what state you are practicing in.
Mm-hmm. And you are practicing in Ohio, correct?
Yes, I am practicing in the state of Ohio.
Okay. Are you able to see patients in any other states, just for those listening?
So that is a good question. So under my chiropractic license, this is where I do most of the functional medicine treatment in general. So basically in the state of Ohio, yes, if I choose to go outside of the state of Ohio, my naturopathic degree may cover it depending on what state you're in and if I'm able to hold a license in those states.
Okay, makes sense. So you've done a good job of defining kind of naturopathic medicine, which led you into functional medicine. So I think another thing that often, or another field that often gets confused with functional medicine or thought of with functional medicine is, I guess, standard medicine, right?
Yes. Yeah.
So how does functional medicine differentiate then from kind of what people are used to in standard care?
Yeah. So standard care, sometimes I like to call standard care sick care. So a lot of times we don't see our primary care providers or other specialists until there's an actual problem. So that's why I consider it more so sick care, because we're already sick when we're in the doctor's office, right? So that's where it kind of splits off. Oftentimes I see people for health optimization or preventative measures because they know, hey, there's an autoimmune disease in my family. I want to optimize my health. So that is kind of where we split. In conventional medicine, oftentimes you're seen for 10, 15 minutes. You're given some kind of script and sent on your way. I spend at least 30 minutes with some of my patients and then another follow-up for another 30 minutes. And I'm constantly following them throughout their treatment plans. So I have a lot of contact with my patients and not everyone is going to get the exact same treatment. So say you and I have the same exact disease. Let's talk thyroid disorders. So I'm going to have a totally different treatment plan than someone like you. But if you tackle it the conventional way, oftentimes the prescription is the exact same. The only thing that might vary is the dosage.
And I think that's why I love functional medicine so much, is because primarily I've been practicing functional neurology and trying, we've been incorporating more and more functional medicine into our practice as well. But I think just the individualized approach, you're not putting anyone in a box. You're not just giving someone a protocol. It's very much, how does the patient present? What are their symptoms? What are their objective findings? What are their lab findings? And what do we do to fix those things? Not just the diagnoses.
Right. And oftentimes I do see patients that are frustrated and have tried everything and they are being told their labs look normal and or they're fine, nothing's showing up. All of those kinds of things we hear a lot. And a lot of times it's just because we're trying to fit a square peg in a round hole. Not everyone needs to be looked at as the exact same person.
Right. So you gave the example of thyroid. Right? So if somebody had, let's say, an autoimmune condition with their thyroid, that's a very common thing that Americans are dealing with. So if you could give us maybe the likely trajectory or treatment path of somebody with an autoimmune thyroid condition through the medical model, standard medical model, versus functional medicine model.
Yes. So I am very familiar with this. I have an autoimmune thyroid condition myself, so I've been through these steps exactly. So Typically, in a conventional model, what will happen is someone's going to come in extremely fatigued, just not feeling well, gaining a lot of weight, potentially dry skin, just depressed. They'll go in to see their PCP, and oftentimes their primary care provider will run just basic labs, usually a CBC, a CMP, maybe thyroid panel being TSH and free T4. Typically, if those are abnormal, they will be then referred over to an endocrinologist. Oftentimes, endocrinology, they will run the TSH and free T4 and something called thyroid antibodies, which are TPO antibodies. If those do come back abnormal with an autoimmune condition, then they will probably get some type of medication, whether it's levothyroxine or something else, and then they'll be sent on their way. Things can be managed and looked at every 3 months until their dosages are leveled out. And that is pretty much what they stay on for the rest of their lives. Versus a functional medicine aspect, if we think there is something going on autoimmune wise, or we know their family is a big component in their thyroid functioning, we will run a full panel on them. So this is going to be a CBC, a CMP, TSH, which is thyroid stimulating hormone, free T3, free T4, antibodies. You get the idea. We run an entire panel because we need to know exactly what is happening, not just a snapshot of just TSH and free T4. A lot of times this can be missed in conventional medicine, and doctors are like, you're fine, but they're starting to brew a little bit of an autoimmune condition. While we run those labs, we also sit down and do a full in-depth intake, which can take anywhere from an hour to an hour and a half, and we'll talk about their dietary just recommendations, what they've been doing, their lifestyle habits, how they're sleeping, weight gain, where is it happening, things like that, so I can get an exact idea as to what might be causing their autoimmune issues in the first place. From there, if I need to run any labs, I can, or any more labs, I can look into gut dysfunction, things like that. But basically, I would most likely give a dietary protocol, an anti-inflammatory protocol specifically for autoimmune condition, and then we'll talk about supplementation if they need it. So a lot of it is lifestyle recommendations, changing habits, and if we need the supplementation, we can always add that in as well.
Mm-hmm. And so it seems like the goal of the functional medicine approach is to not necessarily be on lifetime care too, because you're trying to get to that root cause of the problem.
Absolutely. And a lot of what I do is educating my patients. So they don't have to be on this stuff long term. They don't have to be taking supplements long term. It's all about what are your triggers? What is that root cause? What is triggering a flare up in your symptoms versus potentially have to be on medication for the rest of your life. Now, I'm not anti-medication. I think PCPs and doctors are great. It's just there's a time and a place for what is right at that point in time.
Right. So given the two trajectories, on the one hand, you have kind of the standard model where more likely than not, once the patient's on that medication, like I said, that's kind of the trajectory. They're just on that medication. There's not necessarily a one day you may be off of it. It's more likely than not that's the case.
Yeah.
Rather, the functional medicine model is trying to kind of stop it in its tracks and then just be done with it. So you're not on a medication or a supplement plan for life.
Right. Right.
So I think something that patients might get hesitant of when they initially enter functional medicine practice is maybe the amount of labs, the amount of change that they have to make, or maybe the sticker shock sometimes, the upfront costs. However, I was wondering if you could speak to maybe the cost versus lifetime medication versus kind of that initial kind of shock.
Yeah, I love this question because I do see it sometimes, is like you said, patients are almost shocked sometimes when we do talk about cost, but the conventional model, what we're looking at is a lifetime of medications, potentially complications even. So other added costs down the road that we're not even thinking about right now. So if you may go the conventional route, you might not see how expensive it is in the short term, but adding up in the end for long-term health, other diseases that might be developed in that period of time, we're not even thinking about that versus functional medicine, where I'm showing you an upfront cost. But you also have to think about how much time you are going to be spending with me, how much I am looking into every little thing about you, your family history, your past medical history, the medications you're taking, every little thing. And you have to realize this is an investment in your future health, to not spend all that money later on in the future with potential health complications. So
Mhm.
it can be a little crazy looking at it up front, but that is typically how I like to compare it.
Right. And you know, I know I personally would rather, fix an issue rather
Mhm.
than kind of suppress it for a lifetime.
Yeah,
Right. Like that's the cost comparison is almost not even a factor,
right.
considering what you would have to go through one way versus another.
Right. And I'm not just fixing your thyroid. I'm looking
Hmm.
into every little thing, every organ and system. I'm not treating you as one organ of the body or one complaint. I'm looking at everything. So
Right.
sometimes when the thyroid disorders go away and get better, I'm also adjusting their hormones or their gut dysfunction. So it's not just one area that I'm focusing on. I'm treating people as a whole being, which we should, right? We're all
Hmm.
connected. We're all one system that works together, balanced. So you have to think of that as well.
Right. And the thyroid is just kind of the manifestation of disease, right?
Hmm.
That could have manifested as an infinite number of other things.
Absolutely.
Where I think people, the kind of sick care model is people just
Hmm.
kind of think, oh, well, I drew a bad deck or whatever. I got dealt a
Right.
bad hand
Right.
and I was destined to be hyperthyroid, you know.
Hmm.
But in reality, it's like, okay, let's actually look at what's causing it because
Yes.
it's your disease does not determine your destiny.
Right.
I'm gonna coin
Exactly.
that. That was good.
That was good. I like that. I always tell people, you are not your disease. You are not defined by what you have. It is always something that you can change within reason. You have to put in the work as well. But I'm sure functional neuro is the same. I always think of think of things like, where did this start? You think about the time where you were healthy, what was happening, and then where did that change? It could have been a virus. It has to be some trigger. It's not always just poor genetics or I was just dealt the bad card. It's
Mhm.
always something that's going to be piling on top until basically your bucket overflows, and that's when disease starts.
Mhm. And we mentioned a bit about the treatment approach.
Hmm.
So can we dive a little bit deeper into that even more?
Hmm.
And that what should a patient expect as far as their participation in getting themselves better alongside you?
Yeah. So oftentimes I recommend not only dietary and supplement changes and or recommendations, but I also recommend habits as well. So tracking, like, what are your sleep habits like? Are you on your phone an hour before bed? Are you scrolling through TikTok? What are you doing? Because that also contributes to your health. Dietary wise, sometimes I will recommend specific diets for patients depending on what their symptoms are, if that might be a factor into what is going on. Some people have an extremely clean diet and I don't really have to touch it much. So it's all about meeting my patients in the middle. Typically with supplementation, I go in categories. So a lot of the times I do start with gut support in general, gut dysfunction, just because of the amount of just crap that's in our food, just the stress that we have going on. A lot of people's guts are just wrecked. So most of the time I will start there, and then work my way into different categories like adrenal support or multi-mineral support, or even sleep support. So it kind of depends on each patient. Sometimes I just have to recommend just basic things for health optimization like fish oil or probiotic vitamin D, just things to help support the body as much as I can to prevent diseases from creeping in.
Mhm. And it's been mentioned multiple times,
Mhm.
uh, but the gut,
Yes.
always looking at the gut, and that
Yes.
seems like that is just the bedrock of functional medicine, or the
Hmm.
functional medicine approach. So
Hmm.
I'm curious, what are some of the most common gut disruptors that you've seen in practice that patients might be weary or leery of?
So a lot of times it is medication use, previous antibiotic use, birth control use. A lot of times it does stem from pharmaceutical use. Now, we can't avoid sometimes using pharmaceuticals. It is what it is. But usually when I do intakes and look at paperwork for my patients and I'm asking where did this start from, usually it is from some type of medication. Sometimes it can be stress related. Sometimes it's just their motility is really slow. Their nervous system is out of whack. They're stressed out. They just are not basically pooping and or digesting how they should be. And then another thing I see a lot of is just low stomach acid. So when we're stressed out, our body's not going to produce enough stomach acid to break down the food that we are eating. So it's just kind of sitting there. We're not absorbing what we need to. We get bloated. We just feel kind of gross. So a lot of times it is a combination of medication use and stress
Mhm.
that are huge players into just the gut dysfunction that I'm seeing currently.
And that's a really good thing that you highlighted there, because a lot of times people get stuck on just what they're eating,
Yes.
right? Which is a huge, huge part of it.
Yeah.
But not only is it what you're eating, but it's also what is the context in which you're eating it.
Yes.
Are you stressed out? Are you eating on the run? Like, are you
Right.
in that sympathetic dominant state when you're eating? So you're not producing the correct
Yeah.
enzymes to break down the food, to digest the food. So
Yes.
you could be eating the best food in the world, but if
Exactly.
you're stressed out, or if you're being chased by the proverbial lion,
Hmm.
you're never going to digest that food.
Right. And that is one thing I hit on with every single one of my patients because that is just how we are as a society. We're eating at our desks or we're eating on the go or we're watching our kids and trying to snack. When we do that, our body's in a fight or flight, that sympathetic state. So we're not going to be able to break down anything. Our body is more worried about what is going on in front of you or in the next room. So I have a lot of come to Jesus talks when it comes to bloating around food and we just can't figure out a trigger. A lot of times it is situational and what our body is doing with that food once we eat it.
Hmm. Yeah, definitely.
Yeah.
Um, so what are the different interventions that you might employ in order to fix the gut?
So it varies. So sometimes I do recommend a digestive enzyme just to get some food that is just hanging out there to be able to be broken down to be absorbed. A lot of times I also use either a bone broth or some kind of mucosal support to reduce inflammation and if you've heard of leaky gut before, to prevent any crap or toxins getting in through the cells and into the bloodstream, causing systemic inflammation. So a lot of times enzymes, some kind of mucosal support, probiotics, those are the three heavy hitters I do use a lot.
Hmm. Yes. Um, and then looking at maybe the standard medical approach again, you
Mhm,
mentioned that kind of long-term pharmaceutical use is one thing that
mhm,
leads to gut dysfunction, and then
mhm.
gut dysfunction that can often lead to autoimmune disease.
Yes.
So let's take the patient who's on a lifetime supply of thyroid medication.
Mhm.
Is it something that you've seen that a lot of times those conditions just kind of get worse, or there's more things that end up popping up down the road because
Yeah.
of this kind of cyclical effect?
Yes, I've seen it happen where the patients just aren't getting any better. Their symptoms kind of just even stay where they're at or get worse. And I do often see times where patients just pile on the diseases and the extra issues or the infections that they just can't get rid of, especially if there is some kind of gut disrupting medication that they are on long term. It can absolutely happen just because 80 to 90% of our immune system stems from the gut. So if that is being wrecked and ruined, it's very hard for our body to live in a state without disease. So that is why I do see a lot of issues piling on with patients, either thyroid patients or just patients that are on medications long term.
Um, if a patient is listening to this and they're really resonating with your approach to health, how would they then find you and
Mhm.
practitioners like you?
Yes. So you can find me at Great Lakes Health and Wellness .com, where you can schedule a functional medicine intake. All of my intakes are virtual. They are through the EHR system of Practice Better. So you can find me that way. You can also find me at Dr. Madison Vidovich on Instagram. And if you are looking for someone who is not in the state of Ohio or that is in your state, you can do a Google search online. There is an Institute for Functional Medicine, IFM, where you can look up specific practitioners and doctors that will give you basically a list of doctors all over the country that are certified to practice functional medicine.
Yeah, that's fantastic. And you mentioned you're taking virtual patients, right?
Yes. Yep.
So yeah, which that's a great thing about functional medicine is
Hmm.
that you don't necessarily always have to be right there in person, which
Right.
saves logistical headaches for patients. So
Yes, yes. And patients can access me pretty much at all times. They can message me whenever they have questions or they're struggling or really feel like they need the support. So it's definitely a benefit for both me and the patient throughout their care.
yeah, fantastic. Dr. Vidovich, could you leave our patients with just a last bit of maybe wisdom or hope for those who might be struggling and maybe now encouraged to seek care from a provider like yourself?
Yes. So if you are someone that is just not getting any answers, or you're constantly having lab panels that are run that are coming back normal and you know something is wrong, just because you know your body better than anyone else, please go see someone else, get a second opinion, go seek out a functional medicine doctor or a naturopathic doctor, and they will do a complete assessment more thorough than anyone you've probably ever seen before. So my advice is go get a second opinion, go get the help you need, because you are your own advocate for your health, and your health basically starts with you.
Yeah, fantastic. And I can attest for everything she just said there. But I wanted to thank you for coming on today. This was fantastic. You delivered this information in such a digestible and actionable way, and I loved it. And I know our listeners are going to love it too.
Yeah, thank you
Um,
so much. I really enjoyed it.
yeah, give her a follow. She puts out great content, so learn more and more about what she's doing. But Dr. Madison, thank you again for being on. We'll talk soon. And from
Awesome.
now, all right, this has been your
Thank you so
host,
much.
of course. Take care.